New at 5, there are obstacles other than logistics causing concerns about the vaccine rollout as the president pushes for 100 million vaccines within his first 100 days.
Problem is some people are still hesitant. According to a UGA study, they have concerns about possible side effects, and they also worry about how quickly it was developed. Many saying they'll take a wait-and-see approach.
Channel 2's Wendy Corona joins us now with how to talk to family members who might not trust the vaccine. Wendy?
Well, availability is one factor that is slowing down acceptance of this vaccine, but that is ramping up. So in the meantime, despite many who are anxious for the vaccine, how do we get those around us who are skeptical to buy into it? Well, it's going to take constant correcting of misinformation and sharing of positive experiences for starters.
We often found it often could take a year or two before there were the high overall levels of acceptance.
That was Glen Nowak's experience when the CDC put new vaccines on the schedule for adults and children. He ran communications for its national immunization program and understands vaccine skepticism.
This time was the federal government made a much bigger investment in the research and development of these vaccines. And that made a big difference in terms of how fast these vaccines could be developed and tested.
Left only to vaccine manufacturers, it could have taken a decade with 3 to 5 years of clinical trials, but this only took months as the entire world was in on the benefit.
We are seeing high vaccine acceptance because there's a lot of enthusiasm about being able to return to life as it was before the pandemic.
A lot of people, a lot of smart people did a lot of work to get this out to us as soon as possible.
And are anxious for it, but many still have a wait-and-see approach. Some who are already infected with COVID-19 may feel there's no rush to vaccinate, but Nowak warns
that people who had COVID infection are being reinfected with slightly different COVID viruses. And so
it's not certain how long immunity from past infection lasts, and mutations mean reactions can be different.
As you move farther away from infection, you do have to think about getting vaccinated so you've got longer-term immunity.
And a mutating virus manufactures a lot of misinformation. So in the coming months, data is expected to show how well the vaccine stops the spread of an infection and how long it lasts. So until then, sharing positive experiences around this vaccine, how life may be better once you have it, may help. Jovita?
That sounds really good. How life may be better. Wendy, thank you. So nearly 2 million vaccines have been shipped to Georgia so far. Here's a closer look at how many have been administered.